David Gibson, the Executive Director for the Sandy Hill Community Center, Health Center. We're having an engaging conversation just with regards to what the health center does and what this SIS Safe Infection site will do to add to the facility's already really good resources from what it seems here tonight.
Yeah, I mean, if you walk through the door at any time during our hours, which are extended through the week, we're not open on the weekends, but if you come in with an addiction issue, you are assessed by an intake worker. You are then given an opportunity to either be seen by somebody if you're in crisis, or if there is a primary healthcare issue, if you have an abscess or if you have another condition, you will be booked to see either a nurse practitioner, one of our nurses, or a family physician here. The advantage of an integrated health service that we have here on site is that you get more than just handing out a needle. You can get addiction support, mental health support. Your primary health care is addressed here.
Wow.
We have counseling if you have just addiction issues or if you have concurrent issues with mental health.
I think this goes a lot farther, if I may say, than the original mock clinic on the drop-in center. Tell us a little bit about how it's evolved from the initial mock clinic that was introduced 2 years ago by Dr. Tyndall, the Director of Infectious Diseases at the Ottawa Hospital, Mr. Gibson.
This is not like Insight. This is a small supervised injection service that we're trying to open here within Ottawa.
How many stalls altogether?
I think our model is looking at about 4 or 5. I mean, right now, any given day, we're seeing 60 people come in and we're distributing clean needles. What those 60 people do is, well, they're on the street, so they either inject in public washrooms, in private businesses, in alleys, in backyards, garages. I mean, that's the issue right now for people who don't have a home or a safe place. So instead of having to go over to Pizza and deal with an overdose in their washroom, why is it that in Ottawa they can't come here, be supervised by a nurse, have a safe, clean facility that has access to all the other entry points of health services that we can offer here. And again, not everyone's ready to quit.
I think that's a very important part of what you're offering here, is that this really looks to me as a gateway for help.
Yes.
A lot of people are seeing it, as I'm seeing the perception in the public, it's, you know, it's a shoot 'em up gallery. This is going to ruin the neighborhood. We're going to have people hanging around the streets at 2 o'clock in the morning. And I don't think that they really understand, and I think that's what these sessions are doing, and you're inviting people to come down. Tell us a little bit about these Monday sessions you're having and inviting the public down to see your facility, Doc.
Yeah, I mean, the point of the consultation is really not about whether we'll have one or not. It's really about the model and what it means to the community around and to the people who come into this building to use the service. It is small scale. So the idea is to give the public an opportunity to see our center, which many have not, understand what supervised injection services are and what they're not, so any misconceptions, but also to tour the actual flow of how clients will interact with our center and the services that we